Preventative cardiology is a field of cardiology where we try to prevent cardiology. Now, unfortunately, as cardiologists, a lot of times we see patients after it's too late. They've already had their first heart attack or stroke. They've already had peripheral artery disease. They've already had many of these heart failure, those kind of things, and it's too late. We obviously still need to see you and take care of you and get you better, but a lot of times once these things have taken hold and have occurred, it's very, very difficult to treat these things and make them better. What I love is preventative cardiology. That's why I call myself a preventative cardiologist. I love seeing patients way before, like decades before any of this stuff happens, to try and prevent it, and hopefully it will never happen. One of the things that many of my patients say to me is, "Doc, I enjoyed our talk, I enjoyed our conversation, but I really wish I would have met you 40 years ago." Well, here you are, you're watching this video about preventative cardiology. You have a chance right here, right now, to meet a cardiologist and be seen by a cardiologist 40 years before you actually need us. And that's what we recommend. If you look at all the guidelines, everything is moving towards the direction of prevention. Unfortunately, in this country and many others, we wait until you have an event. You've had a heart attack, you've had a stroke, you've had open heart surgery, you've had heart failure, whatever it might be, and then you are sent to see a specialist or a cardiologist. We want to flip that around so that you start seeing these specialists decades before you need to, so that we can prevent cardiology. There are two forms of heart disease. There's something we call primary prevention and secondary prevention. Primary prevention is this, what I'm talking about now, preventing cardiology before it happens. They sometimes even call this primordial prevention. Like, we want to prevent heart disease at its root core and its root cause decades before it ever takes hold and ever happens. Secondary prevention is unfortunately when we see most patients. They've already had a heart attack or stroke, and we want to prevent a second one. That's why the name is secondary prevention. So we would rather, of course, see patients in primary prevention and prevent heart disease altogether, but there's going to be instances where that's not possible, and secondary prevention is also very good. We now have ways in our system and in our arsenal where we can prevent certain types of heart disease altogether. Atherosclerosis is a disease where we now know how to eliminate it. We can almost completely eliminate heart disease super easy if we get you soon enough. The problem is osteoporosis. It's a disease that starts in your teenage years but manifests in your 60s and 70s. For women, osteoporosis is a devastating disease. Heart disease is very similar. It starts in your teens, 20s and 30s. By the time you're 40, 50, and 60, that's when it takes hold and it starts manifesting, and it's too late usually by then. But we do have advanced therapeutics now where we can hopefully prevent heart disease. That's why I love doing prevention. Talk to one of your doctors at Toledo Cardiology. We will help you get on the right road to preventing heart disease altogether.